calls and emails this weekend. We want to ensure that those that are on the call today have ample time to have their questions answered. Our public health team, as always, is here. Director Jason Volling, as well as his staff. Given that, we know that this is a highly emotional issue and one that requires a little bit of a briefing and kind of guidelines and rules of engagement before we move forward. And so we want to thank everybody that is on that call, on this call, and also that will be listening to the recording for your continued engagement through this unprecedented pandemic. So dealing with the Delta variant and kids returning to school puts us in a very different position than, again, we were even a week ago with tracking the numbers. So we want to hear from everyone. We want to be sure that we have plenty of time to hear from everyone. Questions will be taken from the Q&A feature only. Staff will answer live time or via chat. Any personal attacks, foul language, or disrespectful conduct, verbally or otherwise, to our public health staff will not be acceptable. Again, as we move forward, the level of tolerance for engagement is something that we want to continue, but threats and any additional personal attacks won't be tolerated. So before taking questions, we want to give a brief update on the current status of COVID, the conditions and the response. And please note that the Broomfield Public Health Department has the full support of the City and County of Broomfield as an organization. And together we remain committed to prioritizing the health and safety of our entire community. These are difficult decisions and one that we do not take lightly. We angst over these impacts to our community and especially to our youth. So with that, I'd like to turn it over to Jason Volling, Director of Public Health. Jason, walk us through this item today, would you please?
Yes, thanks, Ms. Hoffman, and good afternoon, Mayor and council members. As you know, we do these on a weekly basis. I'm joined today by our medical officer, Dr. Chris Urbina, and our key staff, Sarah Mock, and also Helene Lanzer, and they will be, again, answering specific questions that you may have as you chat them in for the Q&A. With that being said, I know that the public health order that was released on Friday generated a lot of questions. And so I want to walk everybody through sort of where we're at with COVID and the rationale for that specific public health order. So Sarah, if you could go to the next slide. I think there's some key things that I want to highlight and remind both council members and the public. And we shared some of this last week during our council update. One is the Delta variant has changed the game in the US, Colorado, and Broomfield. We all know we were projecting where we would be based on the original strain of the COVID virus and then also the Alpha variant. What we're seeing with this Delta variant is it's significantly more transmissible, and that's in all populations. And it's potentially more severe. More and more research is coming out in that area. Secondly, the vaccines continue to be and will be our best defense against COVID. And this is how we ultimately are going to end this pandemic. Right now, we're seeing primarily spread among the unvaccinated, which is concerning. Broomfield, although continues to have high vaccination rates, both for our adults and for our teens, and that's excellent news. Our county has really stepped up to the plate. Those that are highest risk, though, remain people who have not yet been vaccinated. And we've seen that over 41% of our unvaccinated residents in Broomfield are under the age of 12 and currently not eligible for the vaccine. Hence, quite a large number of our children that are vulnerable to contracting COVID. And then lastly, Broomfield Public Health and Environment is in a place where we're cautious about the case rates. However, our hospital rates remain low, and we'll continue to use that as our main metric. The last thing that any of us want to do is go back to capacity restrictions and impacts on businesses. And so we'll continue to use those severity metrics to drive decisions. But we are concerned about what we're seeing with the transmission, especially in our unvaccinated population here in Colorado. And I do want to emphasize one thing that came out from the American Academy of Pediatrics. And keep in mind, these are physicians that are serving primarily our kids and children. And they wrote a letter to the governor. And one specific quote in their letter asking for a statewide mask mandate was, "The most important thing we can do for our children's mental health and well-being is to keep them safely in the classroom." So with that, our two overall goals for Broomfield this year are, one, to achieve that goal, make sure that we do not have to close down schools again. And then secondly, that we want to put enough mitigation efforts in place that we do not have to go back to those capacity restrictions and keep our hospital rates well below that ICU bed capacity level. Next slide. So what we're seeing as far as the state trends is this is mirroring the national trends. We're seeing an increase in the 7-day moving average of cases. We're also seeing an increase in the state on pediatric cases. And again, that's concerning. We are seeing that 99% of the cases right now in the state that are sampled are of the Delta variant. And this is what I was talking about before of how transmissible it is. The R naught, or how many people that can be infected if one person comes down with COVID and spreads it, is 2 for the Alpha variant. So for every one person that gets it, they could spread it to 2 other people. With the Delta variant, it's 5 or higher. And why that's concerning is it may seem, well, if it's only 1 person to 5, it's not that big of a deal. But when you consider doubling rates and how quickly that transmits through a community, it can easily add up. And you can see that's what's happened in some of the other states and communities that have been hit hard by the Delta variant. And then lastly, our hospitalizations are increasing in the last week, and we continue to see that among the unvaccinated. You can see where we're at in Broomfield. It's mirroring a similar trend. We are excited to continue to see that 67% of our total population are fully vaccinated, one of the higher rates in the state. It is a little bit concerning, though, because we're part of a overall hospital system. It's not just a Broomfield hospital system, and we continue to see an increase from our North Central Healthcare Coalition in COVID patients that are in the hospital over the previous 7 days. And then lastly, as of August 16th, we've had 163 breakthrough cases in Broomfield. Again, the highest prevalence is among those 30 to 59. Next slide. So this just shows where we're at as far as our transmission status. You can see we were doing extremely well over the summer months, low transmission. Primarily the Alpha variant was predominant, and then the Delta variant became the predominant strain. And this mirrors what we're seeing in the metro region, is that significant slope in the line that shows the increase in cases we've had as far as the 7-day incidence. So we have not changed our metrics. The CDC, though, does now rate communities based on moderate, substantial, and high transmission, and we feel it's important to match up to those CDC metrics. Next slide. So this just gives you a sense of what we're seeing as far as our increases in case rates due to the Delta variant. Primarily, our cases are being driven by that 20 to 29-year-old age group and the 40 to 49. But Sarah, if we could go to the next slide. What is most concerning to us is the increase we're seeing in our 0 to 11 age group. And what you can see is we've seen a dramatic increase over the previous weeks with our 6 to 11 age group and also with our 12 to 19-year-olds. And this is something that's being seen in counties surrounding us as well. Next slide. And I've heard a lot about the fact that COVID doesn't spread as much in the child or the children population. And what we're actually seeing with the Delta variant is it's spreading, it's highly contagious and spreading in all populations, and our kids and children that are not immune to this. So this data is tracked by the American Academy of Pediatricians and Children's Hospital at the national level. And what you can see is we're seeing a significant increase in cases in our child population. And that is concerning to us nationwide in the state and here in Broomfield. Next slide. As I mentioned before, we're doing a great job with our populations as far as those that are vaccinated and fully vaccinated. I want to specifically highlight our middle school and high school students, the 12 to 15, 16 to 19-year-olds, and where we're at with those populations. We're at 72.8% that have completed, had at least one or completed both doses of the vaccine, and 77% in our 16 to 19-year-olds. And this is one of the key factors that went into our decision as far as how we wanted to address layered mitigation within the school settings. Next slide. So as everybody on this call, I'm sure is aware, I issued a public health order last Friday. This order was done after briefing our city council / board of health on Tuesday. And additionally, in working very closely with our two major school districts and looking at our data. And the public health order requires that indoor face coverings are required for anyone ages 2 to 11 in schools and licensed childcare facilities. The masks are recommended but not required for adults in schools and licensed childcare facilities. And the reason we didn't specifically include that in our order is what we're finding is all three of our major school districts are already requiring in their policies that teachers, staff, and visitors have to wear masks. And we are continuing to recommend that masks be worn for both vaccinated and unvaccinated individuals in indoor public settings. This is following the CDC guidance. So effective today, the order went into effect and it'll go through December 31st, 2021. I know that that seems like a significant period of time, but our full intention is to track this on a biweekly basis and to see what we're observing as far as case rates, as far as quarantines, as far as outbreaks, and if any modifications need to be made. And those recommendations obviously would be brought to the Board of Health. Another key factor in putting in the December 31st end date was we know that the 12, or I should say 11 and under population are not eligible for the vaccine at this point in time. What we're hearing internally from some of our national and state partners is they will be eligible in late October, early November. And if it is then approved it in that point in time, we still have to administer it to our children for them to be fully protected. And so all of those were guiding factors in having that end date. And lastly, this order can be extended, rescinded, superseded, or amended by both the Broomfield Public Health Director or the Board of Health. Next slide. And I just want to remind everybody that we're talking about masks, but in reality, we're talking about a layered approach as far as mitigation strategies in the school setting. And why this is so important is we want to avoid significant classroom quarantines, outbreaks, or school closures. We know the impact that those have, specifically on students' learning, but more importantly, on also their social and emotional health. We found when we had school closures last year that increased the isolation and lack of connectedness between our students, and that's where we don't want to go. And so as we look at our layered mitigation strategy, we've been working with our districts to make sure that we're putting these measures in place. And so again, physically distancing and asking people to stay home if they're sick, wearing masks in indoor settings, obviously the hand hygiene, avoid touching your face. And then again, looking at other things that we do as far as quick testing and tracing, having appropriate ventilation, because we know the virus is transmitted both through respiratory droplets, but also airborne particles. And then getting to the point of vaccines potentially being the broadest and the most impactful that we could have in our layered mitigation strategy. So we need all of these in place. And I have to tell you what was most concerning to me when we were looking at and working with our districts was having our unvaccinated youth, 11 and under, going into school, potentially unmasked and having others unmasked, and how highly infectious the Delta variant is, the number of quarantines that we would potentially be seeing. And that was also a driving factor for our school districts because they don't want to see that as well. So we felt that masks, when you weigh the risks and benefit versus having kids out on quarantine, was the best approach to go. Next slide. The other thing I just want to mention is it impacts where we're moving with our public health dial and the order that we had in place as far as level clear. Again, we're going to continue to watch the severity metrics to determine if we ever need to go back to capacity restrictions, which I'm extremely hopeful that that will not occur based on the data that we've seen both in the past and where we're at right now with our 14-day moving average of hospitalization. So this really drives our decisions for broad-based mitigation and strategies and orders, and those will not be recommended unless we start to get back to a place that our hospital metrics are concerning. Next slide. So with that, we're also going to allow our simplified dial framework, or it was Public Health Order 2021-02, expire tonight based on that data. And it will allow us then to have more of a flexible and targeted approach as we move forward, both as a community and council. It moves us away from, again, that dial framework with the capacity restrictions. We'll continue to provide strong public health guidance to the community and our partners. But we're really now going to focus our energy and efforts on, again, increasing vaccine rates as much as possible. That's our way out of this. And on those high-risk exposure settings, and primarily that's in congregate settings, schools, childcare centers, detention centers, long-term care facilities. Lastly, I just want to mention the state does still have a mask order or face covering order in place for specific congregate settings. So mirroring the level of risk, and that's prisons, homeless shelters, and healthcare settings. Next slide. I did want to briefly touch on breakthrough cases because we expect we'll continue to see more and more of these in the state and in Broomfield. And that's because we're seeing more and more of our population be vaccinated. So as I've mentioned numerous times with this council, that vaccine breakthrough infections are to be expected. There's no vaccine that's 100% effective. The reasons that we have breakthrough cases could be specifically the individual and their specific factors playing into that, or it could be waning immunity that we're seeing over time or changes in the virus. So one thing we know is we've had the change in the virus, the Delta variant. There's other variants out there, Delta Plus and the Lambda variant, that we're closely monitoring as far as level of transmissivity and severity. At this point, the CDC continues to watch those cohorts that were initially vaccinated in a longitudinal process or study to determine the level of vaccine effectiveness and waning immunity. And that will then inform our decisions whether or not additional boosters are needed and for whom. And you can just, again, see symptoms may or may not be present. And it, again, just to highlight, everything we're seeing right now is vaccine breakthrough infections and occur in a small proportion of the population. Next slide. So this just further illustrates that. It's just data from the state to show that if we do see breakthroughs, it's primarily going to occur as far as those that contract COVID. So you could see this is primarily in our unvaccinated population, but we are seeing the number of fully vaccinated breakthrough cases starting to increase in the state. And then the next slide. However, this is the good news, is what we continue to see is the vaccines are highly effective against preventing severe COVID disease, hospitalizations, and deaths. And we hope that we continue to see that same level of vaccine effectiveness, not only with the Delta variant, but potential other variants that come along. Next slide. The other thing I just wanted to mention is the Advisory Committee on Immunization Practices. This is a CDC committee, met and they were discussing the most latest research. I'm sure you've seen in the news that they are recommending third doses for those who are immunocompromised. And what do we need to know about that? Those people who are moderate to severely immunocompromised are especially vulnerable to COVID-19 because they're more at risk of serious prolonged illness. And when they receive the initial doses, they may not have built up enough protection at that point in time. And that's why they're calling this a third dose versus a booster dose, because what they're doing is getting them to that level of protection they needed from the beginning. And the CDC recommends those people with moderate to severely compromised immune systems receive that additional dose vaccine at least 20 days after the second dose of the Pfizer or biotech vaccine or Moderna vaccine. The one thing they're not doing is recommending additional doses or booster shots for any other populations. And we have Helene Lanzer on the line who can talk about our strategies to work with the state and our other partners to ensure that these additional doses get out to those that need it. And next slide. And with that, that concludes my presentation, and we'll open it up for questions from the council members. And again, a reminder to the audience that you can type in your specific questions in the Q&A function, and our staff will answer those. So we'll open it up to council members for questions. Mayor?
Thank you, Jason. I couldn't find my hand. Do we know of the severity of any hospitalizations in our younger kids in Broomfield? Do we have any of those numbers?
So yeah, unfortunately, our numbers are so small as far as hospitalizations in Broomfield. It's really hard to make any specific conclusions from that. We are still seeing primarily hospitalizations occurring in our older adult populations. We have seen, I believe it's one hospital admission in that younger age group, but we don't want to make any conclusions based on that. But Dr. Urbina can address as far as level of severity and hospitalizations we're seeing nationwide and specifically in Colorado in that age group.
Mayor, I'd be happy to add to what Jason said. The good news is we don't have many cases in Broomfield. But as we see rising cases, and you see this all over the country, as you see an increasing number of cases in children who are primarily unvaccinated under the age of 12, we anticipate that we're going to see more hospitalizations. And that's to be expected. The more virus out there, many kids have chronic medical conditions, as you know, make them more vulnerable. And hence the public health order that Jason has talked about is that we want to prevent those hospitalizations from occurring. But we haven't yet seen that. And hopefully if we can keep the virus from spreading, because Delta variant, as he talked about, is 2 to 3 times more contagious, we'll keep those hospitalizations down.
Thank you. That's all.
Okay. Councilmember Lim?
Yes. Could you specifically, again, go over what led you and the school districts, at least Adams 12, to decide not to require the masks for the 12 to 19 age group? Because I think that's at least that's the conversation I'm hearing from people who are contacting me.
Yeah, I appreciate that question, Councilmember Lim. I had to go strictly with the data and the Broomfield data that we had. And it was compelling to see, again, the high level of vaccinations that we have fully vaccinated in those 2 age groups that provides a greater level of protection. And with that, I'm looking specifically at Broomfield County, not at the district policies, and making a sound judgment that, in my strong belief, we have done an adequate job to protect those students. However, we are still recommending and strongly recommending to both districts that they encourage students to mask up as an additional layer of mitigation, just like we're doing with our general public, the adult population that's vaccinated. We're at a high level of transmission, and there's always a potential for breakthrough cases.
Okay, thanks. And when we were discussing this at council on Tuesday, because the mask guidance was not formulated yet, there was also a question about the quarantine policy. So have both school districts landed in the same place on the quarantine policy, or what's the situation in the major school districts in Adams and Boulder?
Yeah, great question, Councilmember Lam, and I'll let Helene Lanzer take that as she works very closely with both districts.
Hi, yes, this is Helene. We have worked closely with the EPI teams, and we are in alignment, and definitely the masks mandate has helped that situation. So we definitely are good to go.
And I would just add to that, Councilmember Lim, as we looked at quarantines, obviously we wanted to avoid having broad quarantines as well. What we saw last year where you had a whole classroom or cohort going out. And that's why hence the mask recommendation was so critical to prevent having entire classrooms going out versus looking at those that are again in close contact or in high risk situations.
So will no students who are masked and are exposed to another student who tested positive, they will not be quarantined? Is that the conclusion that was reached, or?
Celine, do you want to take that as far as how we address those specific situations?
Yes, and it's a little bit more nuanced than to be able to just answer it like for any situation. But if someone's vaccinated, that's going to be part of the screening process. We're looking to see if someone's vaccinated. We're going to be looking at if it's more of a routine kind of classroom exposure and being really thoughtful and targeted in terms of, again, like Jason shared, really limiting the number of trying to reduce as many quarantines as possible. So it will still have some nuances where we're concerned about household contacts, but in general, we definitely really trying to limit any quarantines in the general kind of classroom settings.
Okay, thank you. Those are my questions regarding the school situation. Thank you.
Thanks, Councilmember Lim. Councilmember Schaaf.
Thank you, Mr. Valley, and thank you for the presentation. So looking at those breakthrough cases, I believe that you said it was just north of 150 breakthrough cases. With those, do we have demographics on those breakthrough cases?
Yeah, so that's something that our team has been pulling together, specifically looking at the breakthrough cases and in which specific populations they're occurring. Sarah or Helene, do you guys want to share the latest information we had? And Councilmember Schaaf, I'll just say that those breakthrough cases are what we've been seeing since the vaccines were starting to be administered. So think of that in totality, and we're really now trying to look at what's happening on a more week by week basis as far as breakthrough cases to see if we see more of those occur. So Sarah or Helene?
Can speak to it a little bit. We're continuing to watch it. Again, it's important to remember it's very small numbers and very small percent of our total vaccinated, but we are seeing, interestingly enough, more in the 30s, 40s, 50 years old. So we're definitely going to continue to watch that. We've heard some breakthrough cases of school staff and medical staff. And so we'll continue to kind of look at all those trends of, is there any connection of when they were vaccinated? Is there any other connections? But because our numbers are so small still, we don't expect them to stay small. That will just be something we continue to watch and monitor. We thankfully are not seeing that in our older population. So most individuals have had mild symptoms. It's been thankfully not individuals hospitalized, but definitely more, we expect more to continue to kind of watch and see where this continues to go.
And then, Mr. Valley, you had talked about that, with those breakthrough cases, the symptoms are, there's mild symptoms and no symptoms, which is so hard, especially with those no symptoms, to be kind of knowing what's going on with the transmission. But with the symptoms that are in place that we're seeing with those breakthrough cases, are they any different than the unvaccinated cases regarding symptoms?
Yeah, Councilmember Schaaf, I'll let Dr. Urbina take that because he looks at the clinical data closely.
Councilmember Schaaf, I think you're right on the question. The symptoms are generally more mild, but there have been hospitalizations associated with people that have had breakthrough infections. The symptoms are very similar. Once you get a COVID infection, it depends on the person themselves whether or not you're going to have respiratory distress, runny nose, sore throat, diarrhea, fatigue, fever. It really depends on the individual. And it's hard to say whether or not there are trends in breakthrough cases versus non-breakthrough cases, but there have been hospitalizations, and unfortunately, nationally, there have been deaths associated with breakthrough infections. We knew this from the very beginning. If you remember early on when we started vaccinations, we said, still wear your masks. we don't know the long-term effect, how long this immunization therapy does work. We do know 99% plus it prevents severe hospitalizations and death. And I still think that's still valuable to remember. It's worth getting the vaccine because for the most part, it does keep you out of the hospital. So I would encourage people not to say the vaccines don't work, but they do work and they do protect you from significant disease. It's very rare that people get hospitalized and die from getting a COVID vaccine, getting the infection after the vaccine. So it's very important to point that out. Get your vaccine.
Thank you, Dr. Urbina. And Mr. Valley, just one more question. So regarding the, you had talked about the dial is going away as of tonight. So I'm curious, one of the pieces that we were looking at is outbreak cases. So when a facility or event had a number of outbreaks or number of cases, that it would be considered an outbreak. Are we still tracking those outbreaks, and what are those metrics for those outbreaks?
Yes, we're still required to track outbreak cases. If you have 5 or more cases that are linked together, it's considered an outbreak. And then we go in and work specifically with that setting on the appropriate mitigation steps they need to take to address the outbreak. And I would say, and I'll pass this along to Helene to share, where we saw most of our outbreaks last year were obviously in long-term care facilities in the beginning. And then we saw them obviously in schools and childcare settings. And so again, when you think of those higher risk settings due to congregate gathering, that's where we have the greatest concern. Helene, anything you want to add there?
Yeah, just, I mean, that we continue to have the state and the other regulatory agencies implement many, many more rules and restrictions with protocols for the long-term care facilities. So I think they're in an amazing space compared to last year. But with that said, 1 case, 2 cases, it can very easily get in, especially if it's a vaccine breakthrough. And we'll continue to be really careful watching sports, because that's another area that we saw a fair amount at the end of the school season.
Great. I appreciate that. Have we had any outbreaks recently and I would say recently in the summer months?
Yes, we do have a child care center and long-term care facilities, both and with outbreaks. And again, that can get triggered very quickly when it's a long-term care facility versus the 5 or more is a different criteria for all other situations.
And those are all posted at the state, on the state website?
Yes. Mm-hmm.
Great. Thank you.
And we meet with them at least once or twice a week, and we are going over protocols, going over guidance. It's a very close rapport that we've developed with all of our schools and childcares, as well as the long-term care facilities. So it's just really nice to be able to stay in touch with them very closely on what's going on.
Great. Thank you. Mr. Valley, that's all I have. Thank you so much.
Thank you, Councilmember Schaaf. Councilmember Anderson.
Thank you. And Dr. Valley, I really want to say I appreciate you sharing the rationale for why the mask requirement was put in place for ages 2 to 11, as they're not yet fully eligible for the vaccine. And I'm just thinking about our older kids right now. And this is going to be personal choice for the kids that are ages, at least 7th grade and up, or 12 and up, however we want to look at depending on the school. That our children were vaccinated so that they could, and have that freedom from the mask. It was kind of, some of the thought process for many of us. And now Dr. Urbina just shared that even for fully vaccinated, mask wearing is still recommended because there are things we don't know yet. But I don't know if you could provide some guidance on families. I've heard this one from multiple people is they have someone high risk in their family, somebody going through chemo, or somebody who has other health conditions, and they want to be sure that their students don't bring it home from school for those 12 and up. And would you recommend masks? I would assume you would recommend masks in that case, but I'll let you share that. And then also, would you still recommend masks for all kids in school, or are there specific settings, like you had mentioned sports? Like, is there times are there certain settings where they should absolutely have those masks on at school? Any guidance you can provide there would be great. And that's the only question I have. Thank you.
Thank you, Councilmember Anderson. Yes, with the breakthrough cases, that's why the CDC changed their recommendation. They wanted it to be extremely clear to the public that there's a possibility of breakthrough infections, and the viral load is the same in those that are vaccinated and unvaccinated in those cases with breakthrough infections, which then leads to the conclusion it could be passed on to others. And the greatest concern are those that are immunocompromised or at risk. My recommendation again would be to recommend middle school and high school students wear masks again for a highest level of protection. We know though that the breakthrough cases are going to be rare in those situations. And if you have an individual in your household that is immunocompromised or that you're concerned about, I would recommend not only mask wearing within the school setting, but other settings that you're in, and that may even include in your own specific household. Do we have any other questions from council? Or Dr. Urbina, do you have anything to add on that specific point?
No, I think that's right on, Jason. I think that even prior to the Delta variant, if you had a family member who was immunocompromised, I would heartily encourage them to obviously get vaccinated, first of all, but still continue to protect themselves. We knew a while back that the vaccine wasn't 100%. And because of the Delta variant and the highly contagiousness of this, that it's still worthwhile protecting yourselves. Now, the good news is that when Jason shared his Swiss cheese slide, every layer of protection on that Swiss cheese is important. Masks, physical distancing, not going to school, if you're sick, and each of those pieces is very important. And the good news is schools are in Adams 12 and Boulder Valley School District are doing all of those layers of protection, so that hopefully if your child is masking and they're doing that and you're helping the immunocompromised pet relative or parent also protect themselves, I think we can make it as safe as possible, not only in the schools, but for the families that may have immunocompromised family members. So I agree with Jason totally.
And I don't see any other questions from council members. So I just want to also say that in conclusion, I know we're all in a difficult place with this virus. As much as we wish we were in control of the virus, we realize the virus has the potential to mutate, create new variants, and therefore the research, the literature, the science changes. And I can completely understand how frustrating that could be for our public and others who we all feel this level of COVID fatigue. But the second thing I would say, specifically why I feel so confident in this order that we have issued, is there have been some points raised to me that it should be a parent's choice whether or not their kids are allowed to wear those masks in schools. And when I look specifically at that elementary setting, my greatest concern is the masks work in two ways. One is to prevent you from spreading the virus to others, and then secondly, to prevent you from contracting it. So if you leave it to a parent's choice, there could be a potential where you have a classroom where you may have a parent that chooses not to have their student wear a mask, and that individual may be the one that's actually contracted COVID and has the potential to spread it. So it's not, I just want to emphasize, the choice isn't to protect yourself by wearing masks. The choice is to also protect others. And with that, I appreciate all of the feedback, the comments we've received. We will continue to use the best data and evidence as we work through this pandemic and continue to provide frequent updates to you as our City Council and Board of Health. And if we need to, again, adjust or change directions based on what we see in the school year, we're willing to bring those recommendations back to this group. And with that, I just want to thank everybody for your time.
Thank you.
Thanks all.
Bye, y'all.
Thank you.